Well, good evening. It's truly a pleasure to introduce my friend and colleague, Dr. Jay Bradner, as the Hope Fund's awardee in medicine. A native Midwesterner, Jay is a physician-scientist who did his undergraduate work at Harvard, his medical school at the University of Chicago, and trained in internal medicine and oncology in Boston. He's combined his interests in chemical biology and medicine in ways that have created new classes of drugs. As a faculty member at the Dana-Farber Cancer Institute, Jay did something that at the time almost no one would consider. Most scientists, when they discover an interesting chemical, they keep it inside their labs as long as possible. The conventional wisdom is that it's important to allow one to protect the molecule so that if it turns out to be useful, it can be commercialized. However, when Jay identified a BRD4 inhibitor, he made the molecule widely available worldwide. And that drove innumerable studies that helped define the biology of BRD4, as well as the clinical scenarios where perturbing the drug's target would have a potential clinical impact. But more importantly, it provided a new paradigm in drug discovery, that sharing a tool provided insights that either could not be found or would have taken much longer to do so. Personally, Jay is a force. He's charismatic, authentic, and his enthusiasm is infectious. He has the ability to make those around him believe they can make a difference. As much as we miss him at Dana-Farber, it came as no surprise to us that first Novartis and now Amgen would recruit him to lead research and development efforts. His passion to ensure that discoveries get to patients has always been clear, and he's ideally situated to ensure that this continues to be the case. As a leader in academia, an entrepreneur, and a leader in the pharmaceutical industry, he continues to make it possible for more patients to live longer and better lives. As you can see, he's a most deserving Hope Funds awardee.
Thank you, Bill. Thanks to all the trustees and for all of you for coming out this evening and for letting the nerds into this type of environment. We're much more accustomed to lab coats than these coats, but I have to say it's so elegant, and I'm so honored to be here, especially with so many of my own scientific heroes. I have, in the early part of my career, really sailed in all your trade winds and learned so much from all of your research. I'll try to reflect on just three themes that I think are just true about the practice of science when it's being practiced the best. These are three themes that I hope really resonate with the mission and purpose of the Hope Funds, and I hope that it's why many of you, many of us, will continue to be so impressed by these fellows, and will do anything to help you all. Fundamental research, underserved cancers, and the value of unrestricted funding. This is the secret sauce of curing cancer. I didn't intend to be a scientist. I didn't intend to be a drug hunter. I intended to be a cancer doctor, and I trained as a cancer doctor, as you heard, at the Dana-Farber Cancer Institute, and was on the wards with so many inspiring scientists like Bill and Bill here this evening. But I'll tell you, Nick, not all the medicines we had access to were like imatinib. And it was disappointing to care for patients so sick and have such inadequate medicines to offer them, like chemical derivatives of nitrogen mustard gas. And this was only in 1999, despite how old I look today. And so at the end of my training, supported by an amazing woman who's here with me this evening who had a real job, I went back and retrained as an organic chemist, as the oldest living postdoctoral research fellow in Harvard University's history. And I took these 4 years to retrain as a chemist with the idea that if I could learn chemistry, knowing so much about cancer, I could be on these teams that Nick had talked about to try to make better medicines. And I trained with Stuart Schreiber, who I know was hoping to be here this evening. And Stuart never technically hired me. I just kept showing up. And he was too decent a Cajun gentleman to ask me to leave. But my salary was covered by an unrestricted grant. And it gave both Stuart and I a chance to start to get to know each other and work together. And what I learned in his laboratory, I carry with me today, making medicines for patients with the sickest of diseases. When I became a professor, I worked on an underserved cancer. This underserved cancer is a cancer called BRD4 nut carcinoma. It's about 20 people a year will get this cancer, and we figured no pharmaceutical company in their right mind would make a drug for that, and so that we would try. And we made a prototype drug called JQ1, and as Bill shared, it taught us a lot about the protein target BRD4. But we were eager to get this medicine into patients, and it would be rightly illegal to take this medicine from our fume hoods in academia into a clinical study. And so the loophole was we could take cancerous material from the patients that I was caring for and put them into mice and do an early look clinical trial of our patient's tumor in the mouse. And I was caring for this young man called Todd, and he was at the end of his life, and he gave us the gift of this material that was coming out of his chest tube. And it was very powerful. As we were curing the mice that had his disease, Todd succumbed to his cancer. And it really changed me, and my career took a sharp turn towards just an unapologetically translational chapter working to make the best medicines possible. At the end of that time, we had an idea that I'm imagining is part of my being invited here this evening, because unlike these great leaders, my science has yet, I think, really to materialize in the way that yours has. And it was this idea that whereas much of the time we bind and inhibit a protein, could we imagine a way to grab a protein with one arm and grab the garbage disposal system with the other and destroy a protein? Wouldn't that be powerful? And it was a side project that I thought of in our sofa, and we had no funding for it. And so I managed to recruit 2 fellows, Dennis and Georg, each of whom were supported by a private grant that had no restriction on what they might study. And this was a lark. This was a side project, this protein degradation chemistry. And believing in this open science, we published this paper and made the blueprint for how to make these kinds of medicines widely available. And today, every pharmaceutical company practices this chemistry. There are more than 30 biotechs that use it. It's received $4 or $5 billion of funding, not me personally. And there are 12 medicines, most importantly, now in clinical trials. It's so powerful when you have these bright minds, unrestricted in what they're told to work on, to let them really discover something very special. I can't thank you enough for letting me join you this evening. And to all of those receiving these funds, do something special with it. We so believe in all of you and are so excited for your ideas. Thank you.